Thank you. I declare open this hearing of the Public Accounts and Estimates Committee. I ask that mobile telephones please be turned to silent. On behalf of the Parliament, the committee is conducting this inquiry into vaping and tobacco controls. I advise that all evidence taken by the committee is protected by parliamentary privilege. However, comments repeated outside of this hearing may not be protected by this privilege. Witnesses will be provided with a proof version of the transcript to check, and verified transcripts, presentations and handouts will be placed on the committee's website. I welcome Rachel Anderson, Director of Quit Victoria. I also welcome Todd Harper, Chief Executive Officer, and Dr Michelle Scolo, Senior Policy Advisor from Cancer Council Victoria. You're very welcome here this afternoon. I'm going to invite you, Ms Anderson, to start. And then we'll go to Mr Harper and for an opening statement of presentation of no more than 5 minutes, after which time committee members will just ask you some questions. I'll hand over to you, Ms Anderson.
Thank you very much for the opportunity to speak today. So I'm here to talk about Quit's support for important changes that have happened at the federal level to vaping legislation aiming to eliminate the addictive, fruit-flavoured, brightly coloured and widely available products that have proved so attractive to children. This legislation restricts vapes to their intended purpose as smoking cessation tools available in pharmacy settings only. We were pleased to learn of the medicinal packaging, limited flavours and regulated nicotine concentration. While the strongest model would have involved people always requiring a medical prescription to access a vape, selling vapes behind the counter ensures would-be consumers are informed of health risks and other nicotine replacement therapies available to them through a conversation with a pharmacist before proceeding to purchase. In June, Quit signed a 3-year contract with the Commonwealth Government to deliver a new national cessation platform at www.quit.org.au to better meet the needs of all Australians quitting nicotine. This need for nationally consistent and coordinated platform was determined by the anticipated uptick in cessation off the back of reduced supply of vaping products in retail settings. The selection of Quit as the service to nationalise smoking cessation support recognises our many decades of expert work in tobacco control and the undeniable impact that vaping is having on the rates of nicotine addiction in Australia. It also cements Victoria as the home of that expertise in cessation, policy, public health and education campaigns. Now is also a crucial window of time for us at Quit to be delivering enhanced services through delivery of cessation tools that meet the needs of people quitting vaping and, of course, smoking. We know from the 2022 Victorian Smoking and Health Survey conducted by Cancer Council Victoria's Centre for Behavioural Research that most adult Victorians who vape are aged under 30. So we must ensure that quit.org.au tools meet the needs of a younger demographic as they try to quit. New quitting tools may be digital, app-based, easily accessible online, or provide a different avenue to the traditional telephone counselling provided by Quitline services. There is also a strong economic case for continuing strong investment in Quitline. An economic evaluation of the Victorian Quitline service found it is highly cost-effective, improving health and saving costs when delivered in addition to the usual suite of tobacco control initiatives in Victoria. It was estimated that the provision of Victorian Quitline services in 2015 cost $1 million, saving the healthcare system approximately $1.2 million, plus approximately 22,000 life years and 1,480 disability life years over the lifetime of Victorian smokers aged 18 and over. For 4,400 Victorians who tragically but preventively lose their lives to smoking-related illnesses each year, there are many more who are burdened by chronic ill health before their often premature death. By continuing to evolve and expand Quitline services to support more people to make quit attempts sooner in their lives, by ensuring that services meet the needs of younger Australians, the more lives we'll save, the more ill health we'll prevent, and the more money we'll save the health system. Investing in cessation just makes good economic and public health sense, but we must not forget about the vital role that education plays in prevention. At the start of 2024, alongside our partner Vic Health, Quit was proud to deliver the Victorian first curriculum-aligned school resources for students in years 7 to 10. These modules have rolled out throughout this school year and has since expanded with work underway to bring anti-vaping education to late primary school years to launch in 2025. If education is one crucial element to population-wide messaging, then evidence-based mass media campaigns which work at a population level are another. While the media landscape is undeniably changing, becoming increasingly fractured, we are confident that media strategy can help best ensure important messages are delivered to Victorians to prevent uptake, to motivate quitting attempts, and to sustain quitting. By delivering multi-channel campaigns that reach priority populations in digital spaces where they spend time is essential to ensure people are aware of the risks of vaping and smoking and are similarly aware of the cessation support services available to them for free. In the past 12 months, Quit campaigns have run across a multiple of social media sites, have delivered campaign messages via influencers and forged media partnerships with youth publications. We've run ads through streaming and podcast services, gaming sites, YouTube, as well as the traditional means of paid radio, TV and print media. We urge the Victorian Government to continue the support for the vital work of Quit across cessation and prevention of both smoking and vaping, and we look forward to receiving questions.
Thank you, Ms Anderson. Mr Harper.
Thank you. And thank you very much for the opportunity to be here today. Tobacco use has been declining in Victoria since the early 1980s. Efforts by doctors and public health groups over more than 6 decades to raise awareness of the dangers of smoking and the unethical behaviour of the tobacco industry has helped drive this decline, as has 40 years of comprehensive action by successive state governments and strong legislation at the national level. Smoking causes at least 16 forms of cancer and is still the biggest single preventable risk factor for premature death and disease in this country. Disease and consequent health and medical services are not the only social costs of smoking for the Victorian community. People who are addicted to nicotine spend money on tobacco or vapes that they are then not able to spend eating out, shopping at small businesses in their local communities. For many people who smoke or vape heavily, this means not investing in social goods such as saving for a house deposit, taking out insurance, putting away money for retirement. Among people who smoke long-term, 2 out of every 3 deaths are due to smoking. For every 2 people who smoke, 1 will die prematurely, perhaps in their early 60s or even in their 50s. The intense grief of losing a friend, a partner or a parent in middle age is an under-recognised intangible cost of smoking. And these premature deaths and the effects on disposable income and the accumulation of wealth are an under-recognised driver of intergenerational perpetuation of poverty. The rapid increase of young people vaping in Victoria is extremely concerning. Young people who vape are exposed to many harmful substances in e-cigarette aerosol. They're at also greatly increased risk of smoking uptake. And even those that do not take up smoking are using a product with completely unknown long-term health effects and are getting locked into a lifetime of unnecessary spending resulting from the rapid development of nicotine addiction that we see all too often with young people who start using vapes just for fun. Illicit tobacco matters for several reasons. From a public health point of view, it matters because it can reduce the effectiveness of tobacco tax increases in discouraging smoking. It matters because it reduces revenue from excise and customs duty that has been anticipated for spending on other goods and services. The involvement of crime gangs in illicit tobacco distribution, while not new in Victoria, does appear to have stepped up in recent years. It is a concern for the community and obviously requires the strongest possible action by police and federal law enforcement agencies. We welcome the Victorian Government's announcement that it will establish a positive tobacco licensing scheme in Victoria, something the Cancer Council has been advocating over the last 2 decades. People involved in crime should not be involved in any way in selling a product that causes premature death, is addictive and is subject to government excise and customs duty. And a licensing scheme in Victoria will provide the revenue to assess probity of those applying for licences and to employ a badge and uniform workforce, appropriately empowered, trained and resourced, to ensure that licensees adhere to all applicable laws and that no entities sell tobacco without a licence. The widespread unlawful sale of vaping products throughout Australia has facilitated the vaping uptake we have seen in young people, and Cancer Council Victoria strongly supports the recent package of comprehensive reforms endorsed by the Australian Parliament and currently being put in place throughout the country. About 40% of the world's population lives in one of the countries where the sale or use of e-cigarettes is completely banned, and a further 20% live in countries that do not allow general sale of flavoured cigarettes. Youth e-cigarette use is lower in countries that have banned sales. However, illegal sales still do occur in many of those countries. Australia now has amongst the strongest laws in the world in terms of preventing illegal importation and sales to young people, while allowing access to people wanting to use vapes to quit smoking or manage nicotine addiction, with mandated quitting advice, medical warnings and monitoring from pharmacists. New laws prohibit the sale of any vaping products to people under 18 unless they have a medical prescription. The measures in place have already reduced importation of vapes destined for the illicit market, and the reforms passed on the 27th of June will prevent illicit manufacturing from taking off in this country, making it much easier to enforce laws banning the sale of vapes outside the pharmacy chain. But to be effective, Victorian agencies are going to need to honour the Victorian Government's commitment to help the TGA enforce the laws. Smoking has declined in Victoria amongst all social groups thanks to population-wide efforts that affect all sections of the community. However, higher rates persist amongst disadvantaged groups or priority populations. The last stage of the tobacco epidemic in Victoria will require intensive support for people who are highly addicted to nicotine. Quit is pleased to have secured major contracts in recent months to provide important cessation or quitting services to the Victorian community and to the rest of Australia. However, we would welcome the opportunity today to discuss with you major barriers we face in maximising the benefits of that money for Victorians. It has been more than 7 years since the Victorian Tobacco Act was last amended, and in our submission we have brought to your attention several areas where Victoria has fallen behind other jurisdictions, and addressing these will help prevent further uptake and support for Victorians trying to quit and to stay quit. Now is an important opportunity for the government to support and enable the delivery of quitting media campaigns to educate and inform the public about the harms associated with smoking and indeed vaping. In our submission, we point to difficulties we've encountered in getting timely government approval for our life-saving public education campaigns. We think these campaigns are vital in supporting the efforts of the governments and parliaments to reduce mortality and morbidity, and we'd be pleased to take any questions. Thank you.
Thank you so much, Mr Harper. Mrs MacArthur.
Thank you, Chair. Go to Ms Anderson first. What's your contract with the federal government? How much are you getting to roll out your campaign?
So we've recently received a contract from the Commonwealth Government to deliver a national cessation digital platform, and it builds off the quit.org.au web page that we have, and what it will be is a more comprehensive digital platform supporting all Australians, no matter where they live in Australia, to best practice tools, evidence and supports to quit. The contract is over 3 years and will help provide that support to all Australians.
And worth what?
Sorry?
What's the value of it?
It's $10.3 million over 3 years.
So we've just heard from some young people here who think that whenever they've seen anything to do with quit, it's not hitting the mark at all. So we're getting value for money out of your advocacy?
I think what this new funding will provide us, and we've also recently been provided with a commitment to expand our quitline services as well in light of the new national federal vaping legislation. I think what that does give us is the opportunity to really look at the youth market as a new demographic that we need to be supporting to quit. We know that...
So you haven't been looking at them before?
We have, but we haven't had the resources to really fully develop digital tools and to really be able to support young people in ways in which they like to engage. So we know that young people don't always like picking up the phone and having phone conversations, that they are more likely to engage digitally.
But what they've seen digitally is not hitting the mark at all.
Yeah, we are looking to be able to develop new digital tools, and we'll be doing that with a co-design process. It'll be very user-centric. We'll be looking at the needs of young people and other priority population groups as well as young people to be able to really design those tools to be able to meet their needs and where they're at.
Mr Harper, the law enforcement authorities have informed us that they can't even touch the illegal market effectively. They're lucky if they get 1 in 10 shipments that they can track down. There's no real penalties involved, so it's a very lucrative market. So brought about really by the increase in excises on tobacco particularly. So we've created a market in the criminal world for this product. Is that a successful model?
I don't think we've done enough over the last decade to provide the additional encouragement for people to quit. We've seen the tax increases have been applied. We haven't done enough in terms of education. We haven't done enough in terms of a joined-up approach between federal and state around enforcement. Thankfully, I think this committee and the work of the TGA and the federal parliament in recent times, I think, is pointing to a change that we are seeing, which is a very welcome change. I think it is important in this next period to also be stepping up our efforts around education to ensure that we're not just relying, as effective as tax increases can be, just relying on tax increases. But to further expand on in response to your question, I might ask my colleague, Dr. Scolo, to make a few comments.
Yeah, certainly the federal government has been pursuing tax policy in a very energetic and vigorous way for the past 10 or more years. Until last year, virtually no other tobacco control policy in Australia was implemented since plain packaging was put into force in 2012. So it really was relying almost completely on tax increases. Very little funding at the federal level for campaigns. And what has happened in the last 6 months with the legislation that will now come into force federally is very well...
What, having pharmacists become tobacconists?
No, I'm talking about the restrictions on tobacco under the Public Health and Tobacco and Other Products Act from August last year. So international experience suggests that tax increases are very effective in reducing consumption, and in fact...
But it's led to a massive black market here, hasn't it?
Well, in fact, the countries with the highest taxes have tended to have the lowest levels of illicit tobacco, and that's certainly been the case in Australia until very recently. So surveys from the National Drug Strategy Household Survey shows almost no change in the level of people using chop tobacco or cigarette packets without the Australian packaging between 2010 and 2019. But yes, there's been a very big jump between 2019 and 2022-23. That must be partly driven by price, but I think the international experience suggests that it's not just price. That's the factor. What we've had here, Australians are a very law-abiding country, and very few Australians are willing to go and buy tobacco products out of a car boot or anything like that.
No, but they can go down the corner shop.
But what has happened in the last couple of years is we're now, for whatever reason, seeing sale of illicit products from high street shops, whether it's standover tactics from criminal gangs or whatever. So we're at a point now where we need much more serious action at both the federal and state level. We're really glad that Parliament, in passing the Act last year, insisted on the appointment of an illicit tobacco and e-cigarette commissioner, and the appointment of that person was announced last week. And it'll be whatever measures they can come up with that will effectively address action at the federal level will be very welcome. Illicit tobacco what the international authorities say about illicit tobacco is that the most fundamental thing in controlling it is for the government to have control of the supply chain.
Well, they certainly haven't got that.
And we do
According
not,
to the authorities, not likely to get it.
we do not have that at the moment, and that stems very largely from the absence of a licensing scheme in Victoria. If we had retail and wholesale licensing in Victoria, it would mean that the federal government could licence wholesalers and say wholesalers must not sell to any retailer that doesn't have a licence. Once that's in place, state governments can say no retailer can buy from any wholesaler who doesn't have a licence, and then you start to get control of the supply chain. So it's a pretty dire situation at the moment, but we're hopeful if the Victorian government can act very quickly to get these licensing arrangements into place, that things should start to improve.
So you think all the people buying illicit products at the moment, which are a fraction of the price of the legal product, will suddenly switch to a legal product at a much higher price if we regulate and licence more retailers?
If we regulate and licence retailers, then retailers that sell these products will potentially lose their licence, and these products won't be available for people to buy.
But the criminal world will find another way of introducing a product that's dramatically cheaper than the licensed product, right?
So obviously the work of a licensing authority has to work hand in glove with work by the police, looking at the criminal infiltration of these supply networks, and that needs to happen in concert. So I think, and the Better Regulation Victoria review was very strong on that point, and I think had useful insights about how a licensing authority should work in order to collaborate with police activity.
Well, does there need to be criminal sanctions of the order of what happens with illicit drug problem issue?
Certainly the sanctions in Victoria are not very high and don't seem to provide...
You just get fined.
It's just a fine. There's no jail time. And also...
So do you think there should be?
I think that loss of licence is probably the most important factor. If retailers can't sell anymore, that's a major deterrent to engaging in illicit tobacco.
Apologies, Mrs MacArthur. Mr Galea.
Thank you, Chair. Thank you for joining us. Mr Harper, is there a causal link between vaping and the uptake of smoking?
My colleague Dr Scholar.
There's absolutely an association. There's no question of there being an association. So young people who vape are 3 times more likely to take up smoking. There's debate on both sides of this argument, and some people say that that people that vape might have taken up smoking anyway. But the best studies actually control for the kind of factors that predict uptake of smoking. And those studies are still showing that there's a significant increase in uptake of smoking among people who vape. There's all sorts of reasons why you might imagine that might happen, the development of nicotine addiction being the main one. So I think that the evidence the people that have reviewed the evidence are pretty clear that it's a major factor.
Thank you, Dr. Scholar. Perhaps I'll notice if you could point us in the right direction of some of those studies that you're referring to, that'll be very useful.
Yep.
Ms Anderson, I might turn to you now. How much of the work of Quit Victoria has shifted from cigarette smoking to vaping and other more modern sort of forms over the past few years? What's that shift sort of look like?
Yeah, we certainly have seen a shift in our focus, but having said that, we recognise it's equally important to maintain a focus on both smoking and vaping because of the link that Michelle has just spoken to. But we do recognise that that vaping is an emerging, or it is a public health issue, and that we do need to respond to it accordingly. So our emphasis continues to be on smoking, both cessation and prevention, but we also have now extended our work into vaping prevention and cessation, very much oriented at priority populations and a youth segment.
Thank you, and I don't have a lot of time, so I'll just lastly ask as well. We heard from Vic Health that Quit Victoria has been using new ways, and I think you were referring to this before with Mr MacArthur about digital ways of engaging with young people, and I understand there's like a WhatsApp service as well that you offer for tobacco or vaping addiction for younger people. Can I ask you to briefly outline that program and what sort of trends you're seeing from that engagement?
Yeah, so we offer a range of different ways that people can access Quitline services currently. That includes, like I said, the traditional telephone counselling, but more recently we have offered other ways to be able to connect to Quitline. That is via WhatsApp, it's via online, you could use Facebook Messenger and connect up to our services. What that does is connect people still to qualified counsellors and so accessing support through different means. We are looking to the future to look at how we can build in AI technology into those digital supports and those digital apps. So we have got ambitions really to be able to extend that work beyond our current reach. And into new technologies.
Terrific, thank you. If you do have any data on sort of the uptake of those services that you're seeing, it'd be great to have that on notice if you can. Thank you.
Thank you, Mr Galea. Mr Puglielli.
Thank you, Chair. Good afternoon. Could I just hear a bit more about, do any of you have concerns regarding nicotine pouches, I should say, that are seeing significant uptake in other jurisdictions overseas? Are there any concerns from those products that you're identifying that you'd maybe want to speak to us about?
Yeah, certainly nicotine pouches are emerging as a kind of third choice for industry maintaining a nicotine market, and it seems like they're aimed at the situations where you can't smoke or you can't vape. You can use a nicotine pouch product surreptitiously. So certainly that's a concern for its role in maintaining community addiction to nicotine and potential use of other products. It's not an inhaled product, so perhaps there's a lesser risk profile from that point of view, but these things haven't been used for very long, and there just isn't the long-term data available. And of course, we would point to the issue of nicotine addiction being a health effect in itself that's a concern, particularly for young people.
Okay, no, good to get that positioning on the record. How about heated tobacco products, sort of alternate devices that are being used by some of the companies that we've heard from earlier today?
Yeah, heated tobacco products are not something that we've seen in Australia to any large extent. They're not showing up in our surveys. They're not lawfully sold in Australia, given the various ways the federal regulations work. It still is tobacco being heated. If you talk to a biochemist, the definition of what becomes smoke and what is potentially cancer-causing is, not quite so clear-cut as harm reduction proponents sometimes portray. So we certainly wouldn't like to be seeing heated tobacco products prominent in Australia.
Thank you. Yeah, any further comments you'd like to add at this stage? No? All good. We spoke a bit earlier about possible changes required in terms of enforcement with regard to these products in this country, particularly as the new sort of laws federally come into place. What, in your view, would be best enforcement approach?
The best enforcement approach for
and that could be
vaping products?
Yeah, that could be in terms of like resourcing. I think police you touched on earlier. What approach should we be seeing across the country, or particularly in Victoria?
Do you want to start with that?
Yeah, so we note that there's no immediate amendments that are required to Victorian legislation that are likely need to be made to implement the federal vaping laws.
None, did you say? None.
That's correct.
Okay, good to know.
But we do note that there needs to be, to ensure the effectiveness of the federal reforms, we need support right across state and federal governments in a number of different areas. And that includes coordinating the shutdown of retail vaping sales, and that really is about a coordinated approach across all jurisdictions. And the implementation of the reforms will be closing down the sale of vaping products in specialist vape retailers, convenience stores and other general retail settings. There needs to be collaboration across Commonwealth and state and territory governments to ensure structured and well-planned approach to the retail shutdown. And there needs to be a comprehensive statewide communications plan, and this is really important for retailers being aware of what their obligations are under the new laws and how day-to-day enforcement activities are going to operate. And that collaboration should occur right across all states so there is consistency. But we also really want to see strong and swift enforcement and action against parties found to be importing or manufacturing non-compliant products, and that's essential. And that the penalties for non-compliance with the new laws, they must be significant to ensure they're not viewed by the industry as an acceptable cost of doing business.
Thank you. Just to sort of pick up on some of the points we were just going to earlier regarding concerns around nicotine prevalence across the community, be it via the products we have in Australia or other products we're seeing overseas. Earlier this morning we spoke about what are we aiming for here? What is success? What does that look like in our context? Is success for you eradication of these products, or what should we be aiming for in the long term?
I think we want to be focusing on the harms. We want to be reducing the harms, as I mentioned earlier, the significant burden that comes with associated with these products. So that would be the focus. And one of the pathways that has been exploited for so long now has been that of an addictive product, and strategies put in place by industries to maintain that addiction. And so that's been a very, very successful pathway that industry has used, and it's often been young people, vulnerable groups in our community that have been in the sights of industry that perpetuate those harms. So for us, I think it's certainly around the harms, and particularly around the cancer aspects.
Do you think there's, at the state level, enough public health spending being put each year to address the harms associated with these products?
No, there's not. So public health always, for strange reasons, attracts a small share of health budgets, despite the enormous potential it has from a health and an economic perspective. So we as a state, as a country, we don't value sufficiently investment in prevention to prevent these harms that we see. And as I mentioned in my introductory comments, one of the concerns that we have at the moment is that the difficulty we have in getting approvals through government to invest in these life-saving campaigns to use the funds that we do have at our disposal. So we certainly think there's an opportunity to address that so that organisations like ours are as well placed as we can be to support the government, support parliaments in reducing those harms that I spoke about earlier.
Thank you.
Thank you, Mr Puglielli. Mr Hilakari.
I know we're well over time, so maybe we can even take this on the record, Dr Scolo. So, and I hope I heard you correctly in mentioning that those high tax jurisdictions also have low illicit markets. I'm just hoping you could provide some evidence that backs in that statement from some other jurisdictions I know, and thank you so much for your extensive submissions. They're really thorough and go to the price sensitivity of those people who are smokers. So that would be really appreciated, and also understanding the connection with the licensing structure that you've talked to in that submission as well.
Yep.
Thank you.
That was very quick, getting us back on track. Thank you, Mr. Hilakari. Mr. Harper, Ms. Anderson and Dr. Scolo, thank you very much for coming and talking to us this afternoon. We could talk to you all day. We'd have so many questions. But as the chair, I am unfortunately the timekeeper. The committee is going to follow up on any additional questions or questions taken on notice in writing, and responses are required within 5 working days of the committee's request. The committee is now going to take a very short break before recommencing the hearing. I declare this hearing adjourned.